Welcome to the tutorial on how to keep Bentley surviving until mom and dad come back from their trip. Bentley has a condition called chronic bronchitis, meaning chronic, long-lasting for the rest of his life. He will have chronic bronchitis. We can't give him medications to cure it, but we're trying very hard to manage his condition. Managing his condition involves giving him certain medications. I would like to first of all go through the medications that Bentley is on with instructions on how to administer it. Okay, so let's first go over the oral medications. Okay. The main medication he takes is called prednisone. Prednisone is an anti-inflammatory drug that helps with his cough to reduce the inflammatory cells in his lungs. Okay. Now, prednisone is the main drug. However, it unfortunately causes bad side effects. So you will notice that he's frequently hungry and he's frequently thirsty. So he also has to go out to the bathroom, shishi and doo-doo quite frequently because he's always drinking and he's always pooping. Okay, so that is one of the bad side effects. Another side effect is that he's very anxious. You know how Bentley always shakes? Well, he shakes even more so when the prednisone pill is at its peak. Okay. So right now, in terms of the prednisone, we are giving him a half of a tablet twice a day. Prednisone also has a side effect of affecting and possibly causing ulcer. That being said, we have to give him an acid controller with the prednisone to prevent Bentley from developing an ulcer on prednisone therapy. This is also given half a tab twice a day with the prednisone. The last oral medication that he's on is called butorphanol, which is a drug for, it's a cough suppressant. Now this, we've tried different cough medicines. This has turned out to be the best so far. We give this to him at night before bedtime, just before bedtime. That will keep him rested for at least 2, perhaps 3 hours. Then he will wake up wanting to go shishi and doo-doo, not necessarily needing this. When he needs it again is when he starts his coughing fit. This happens about 3 to 4 a.m. in the morning. And so once he starts coughing, you give him half a tab, okay? So half a tab just before bedtime and half a tab when he starts his coughing fit at 4 a.m. Okay, now this drug does so far work wonders. Okay, so we've been giving him prednisone for approximately over a month now, at which time he has shishied in the house and waking us up every 3 to 4 hours. Okay, so we've tried to wean him off to reduce the amount of oral prednisone, systemic prednisone that we give. So instead, we're going to give the inhaled corticosteroid called QVAR. QVAR is a steroid that you will be giving him twice a day via the inhaler. It is in the brown puffer inhaler. Okay? All right. The other inhaler is called the rescue inhaler, Ventolin. So you would be giving him this, Dad. You don't have to whisper. This is not a professional tutorial. Okay, so this Ventar you only give when he is having his coughing attack at 3 to 4 a.m. Okay, so when he gets his coughing attack, you give him the inhaler Ventolin, 1 puff, and also you give him the cough suppressant. I would like to demonstrate how to give him the the inhaler. Okay, so for all of the inhalers, you need this device called AeroDog. This is called a chamber, so that the inhaler goes in here and that he breathes it through here. Okay, so we have a box with instructions on how to clean it about once a week. Okay, so now we're going to be giving the QVAR, which is the inhaled corticosteroid inhaler. All right, so attach the end of the inhaler insert it into the chamber. Shake it so that the medicine can come out, is well mixed. Okay, now it is best that the 2 of you do this together. One person hold him, and the other person will place the AeroDog onto his muzzle. So before you give him the AeroDog, you shake it, and then you release, and then place it over his nose. And as you can see, he's not happy about it, but here he goes. Now, if you look closely, when he takes a breath, it flutters at the very top here. It flutters. There he took a breath. There he took another breath. And you'll want to see that he breathes for about 6 times. 4, 5, and 6. Again, it's better that the 2 of you do this together. Okay, but it can be done by one person if necessary. And that's it. Thank you for listening to the tutorial on how to make Bentley survive. Okay, Dad, do you have anything to add?